Old days, golf balls were made of rubber bands. You can't get these anymore. Now they're some kind of neoprene, modern, whatever. Yeah, they're solid. But this is how golf balls used to be, and this is my representation of how the body is wrapped. Deep inside this thing, where you can't see it, is a little ball that is called a pill, and it's filled with liquid, a liquid center pill. Did you have something you wanted? Come on back in about 10 or 15 minutes, and that'll cover all the loose ends, and then you can have the floor. Okay. Can you come? I want to say about 12:30, 2:15. 2:15, say? Yeah. Okay. All right, we'll see you back at 2, and we'll have lunch at 2. So I'm going to make this real quick. Here's the thing about the body, is that all of its tissues are under tension. And then all that tension is kept in by the superficial fascia, and that's the superficial fascia right there, the white stuff, the hide. Okay? So the question is, what happens when a surgeon comes along and makes a cut? And what happens is anything that gets cut retracts and ends up on the opposite side. And that will be true in any surgery. Now, I'm not talking about scraping a wart off the surface. And I'm not talking about, superficial. I'm talking about incising into the body cavity. Anytime that is done for any purpose, this is what will happen. The tissue will. So let's take Gloria's case. They split her chest. It's called a thoracotomy, a chest crack. So when they did that, all of this ended up in her spine. And she's had this ropey gathering of tissue all along her spine that I have spent the last 24 years sending back where it came from, or close to where it came from. This is an extreme case of tissue borrowing, but it's not just, it's not just like that pulling something. This is extreme. Yeah. Yes. It's like when you tear an Achilles and then they have to go up and get it and pull it back down. Well, the body is always doing that in any surgery. So, and that is regardless of what they went in for. Just the process of going in and coming out leaves the body disorganized like that. So if somebody comes in and said, "Oh, I had a hysterectomy," well, you can kind of look back here to find all of that gathered tissue. And that is a thing that nobody will ever address unless you do.
Sharon Wheeler also.
Yes.
Because then you have to lay down on your bed, and you have to do that with 2 people. They have to pull the tissue outward on both sides at the same rate, at the same speed, and then it's opening. This is closing wall.
Yes. Well, there are a lot of ways to do it, but be aware of what you're dealing with. Anytime somebody comes in and reports a surgery in their intake interview, even if it's a fairly, innocent and seemingly benign surgery, you can always look for this phenomenon. This is a universal truth, a generalized principle. Anytime you cut into the body, it will always retract that tissue and gather it on the opposite side. So think about that in the back work when somebody has had an abdominal surgery.
My next question is, after hearing you do a 10 series, you say don't come back for 6 months to a year unless something occurs. And then when you said that you have been working with your wife over particular issues for 24 years, I'm assuming that you don't tell her to come back in 6 months.
No.
I'm also curious, are there certain situations where you would say this is kind of going to be a lifetime thing? Like, I'm not sure that.
Yes, there are issues that for people will be a lifetime thing. So I try to moderate their expectations, to say this is something that's going to take a while to unwind. It's not going to happen all in 10 sessions. Kind of give them kind of a longer, let them put on their longer hat to expect the work. So what you're asking me is, why would anybody need to be rolfed to sleep every night for 24 years? Well, you saw that burned back. Well, now that's not Gloria. She's not nearly